To axillary now, which supplies the main part of the deltoid, which is the main adductor of arm. So surgically it is important because it is mostly involved in the surgical dislocations. It takes its origin from the brachial plexus that to posterior cord. So its root values is C5 and C6. So coming to the cause, in the axilla, it lies on the subscapularis muscle. In the after that, it has in relation, suppose this is medial and this is lateral. Medially, it lies in close relation with the radial nerve, and laterally, it lies in close relation with the coracobrachialis. So that's how it enters, leaves the axilla, and it also in the axilla it gives a branch to capsule of shoulder joint, supplying the articular branch, and leaving the axilla, it enters into quadrangular space. Coming to the boundaries of quadrangular space. Superiorly, you have anterior and posterior parts. Anteriorly, you have the subscapularis muscle, on which the anterior part it has the axillary now passing through, and posteriorly you have the teres minor. And coming to the lowest part, you also have the capsule of shoulder joint. Apart from that, laterally you have the surgical neck of the humerus, and other boundaries include inferior and medial boundaries. Inferior boundary, it is nothing but teres major, as you can see in the diagram. I didn't do, but yeah, and medially have the long head of triceps brachii. uh, since you know it covers both this quadrangular space and upper triangular space and lower triangular space. And so coming to the divisions, you have anterior and posterior divisions. It divides at the level of posterior part of deltoid to anterior branch. This is our anterior branch. This is accompanied by posterior circumflex humeral vessels, vessels in the sense artery, vein, and nerve. Here it winds around the surgical neck of humerus, that is deep to our deltoid muscle. So here it supplies the deltoid muscle. In addition, it also supplies the skin over here over the posterior inferior part. Coming to our posterior part, so this is our main part right now. So what it supplies is teres minor along with the posterior part of deltoid, of course. The part supplying the teres minor, it bears a pseudoganglion. Pseudoganglion is nothing but fat plus fibrous tissue and without neurons. After supplying these two muscles and ending as a pseudoganglion, it then passes and pierces the deep fascia here. And after piercing the deep fascia along the posterior part, it continues as little cutaneous nerve arm.